Good day, my name is Ethel Perales from Bees and 3B, and today's video, I'm going to perform the assessment of heart and blood vessels. For preparation, we assemble equipment and supplies such as the ruler with centimeter, the marking pen, the BP apparatus because we're going to be checking our client's blood pressure, a stethoscope with bell and diaphragm, and the alcohol swab to clean air and end pieces. Now let's do the procedure. First, introduce yourself. Good day, sir. My name is Ethel Perales, a student nurse of Menescos, your assigned nurse for today. May I know your full name, sir?
Jose Morales Jr.
How about your birthday, sir?
July 25, 1996.
Okay. So after identifying the patient, explain to the client what you're going to do, why it is necessary, and how the client can cooperate. So today, sir, I'm going to assess your heart and blood vessels, wherein first I'm going to measure your blood pressure, your activity tolerance, and then I'm going to touching your body, because I'm going to be palpating your arterial pulses, auscultating arteries and veins, and your heart sounds. So this is necessary for us to determine if there are any abnormalities. Would that be okay, sir?
That's fine.
Okay. After explaining the procedure to the client, we wash our hands and observe other appropriate infection control procedures. So assuming that we're already done washing our hands, then we provide client's privacy. After providing client's privacy, we determine client's history of the following. So sir, before we start, I have some questions for you. Do you have a family history of incidence and age of heart disease, high cholesterol levels, high blood pressure, obesity, stroke, congenital heart disease, arterial disease, hypertension, and rheumatic fever?
No.
Okay, so do you have a past history of rheumatic fever, heart murmur, heart attack, varicosities, or heart failure?
No.
Okay, present symptoms indicative of heart disease,
No.
or presence of diseases that affects the heart?
No.
What is your lifestyle habits?
I love eating and exercise.
So after determining the client's history, we measure the client's blood pressure. Sir, I'm gonna measuring your blood pressure. So we take blood pressure to detect the actual and potential orthostatic hypotension and therefore the risk for falling. Okay, sir, I'm gonna be measuring your pulse rate. Okay. Okay, sir, your pulse rate is 81. Okay, so we have the client lie down for 5 minutes. Take the pulse and blood pressure and pause after client setting, and again at 1 minute after client stands. Okay, sir, can you please lie down within just 5 minutes? So after 5 minutes, I'm gonna taking the patient's blood pressure and pulse rate. First, I'm gonna take your pulse rate again. Then again, after 1 minute after the client stands. So for exercise tolerance, we measure activity tolerance. Evaluate either by reviewing results of stress testing or by observing the client's ability to move from a sitting to a standing position or to flex and extend fingers rapidly. Okay, sir, can you please stand up? Okay, so now, can you please sit down? And you can lie down just a few minutes. Sit again. So after measuring the activity tolerance, we determine the adequacy of blood flow by palpating the arterial pulses in all locations: the carotid, the brachial, the radial, popliteal, posterior, tibial, and dorsal. So for strength and quality, we'll palpate the carotid arteries gently and one side at a time to avoid stimulating vagal receptors in the neck, dislodging an existing plaque or causing syncope or a stroke. So we start by looking at the veins in your neck. For that, I need you to lay down 45-degree angle in supine position, which means flat. Okay, then I ask you to turn your head left. His head is only turning left, not his body. Because I'm looking at the vein in your neck, so it should be flat, and that would be normal. So in some people, you could see the vein, especially the skin tone, is very large. In some people, you couldn't see it at all. But there should be a notice odd, and that should be flat. So if you say vein itself is large or bulging, and that is an indication of increased skin pressure, and there would be an abnormal. Alright, you can sit back, and then I'm going to palpate your cardiac pulse. So I'm going to be putting my fingers right next to the trachea, half of the midway at the neck. And what I am feeling for is the strength of the pulse. So a normal strength would be 2+, and I'm also feeling for the upstroke, and it should be nice and smooth and strong. And then I'm also be doing the same thing on the other side. And then I feel that this pulse is 2+, and the upstroke is smooth and strong. Then I'm going to listening the carotid artery and listening for a groove, which is a swishing sound, and I'm going to be listening using the bell of my stethoscope here. That would be here a low pitch sound. So I'll place my stethoscope about halfway of the neck. So can you take a deep breath in and out and hold, and I should hear the pulse, and I should not hearing swishing. Okay, so the other side. Can you take a deep breath in and out and hold? So I hear the pulse can breath. So and I don't hear any swishing. Elevate arterial and venous sufficiency and extremities. So we elevate the heads above the level of the heart and observe color, temperature, size of the legs, and the skin integrity. So we elevate the legs. So we know the size of color, skin integrity. Check. So then after that, we inspect and palpate the veins while the client is standing. So assuming that our patient is already standing, so we inspect the veins here, palpate the veins. So same on the other side. Okay. So then after that, we inspect and palpate the precordium, which is parts of the chest that surrounds the heart. And I'm looking if I can see any pulsation and any movement there, but I only see is the respiratory movement. And then I'm going to palpate the point next small impulse, which is at the midclavicular line and at the first intercostal space. So we put our fingers right here at the ribs and join between the ribs, and then you feel that pulse. After placing our warm hands at the apex, so we feel for apical impulse, if palpable, and it should lie at the left midclavicular line. So the impulse should be no longer than Pistolian Benon, wider than 1 centimeter, and it should feel gentle with no lips. So now we move to the left sternal border, here, feeling for a displaced or wide impulse or other abnormalities, and then palpate at the base of the heart to detect any problems. So next is here. Fine rushing vibrations called trills may be felt on this side. So next is here. During palpations, we determine the point of maximal impulse where the apical impulse is strongest. So with your finger on that point, please can you turn your head like this? Use your other hand to palpate the carotid pulse, which should be synchronous with the apical impulse. So after that, I'm going to be moved by auscultating the heart sounds. First, we start by finding the second intercostal space. So from the clavicle, so there's a space 1 and space 2. Or you can find the angle with this in this part of sternum. And right across there is the second intercostal space. So I'm going to start by listening using the diaphragm of my stethoscope. So we start in the aortic area, just right here. So I'm going to be listening for the S1 and S2. So the love dot. And I'm listening for any clicks or extra sounds or murmurs. So right across on it is the second intercostal space left of the sternum, the pulmonic area. And then we move down. I'm going to be listening at the tricuspid area. I'm gonna listening just right to the sternal border. Then finally, at the midclavicular line, the mitral area. So I heard S1 and S2, the love dot. I did not hear any clicks or extra heart sounds. I did not hear more. Okay, so then I'm gonna do the same thing using the bell of the stethoscope. First at the second intercostal space to the right of the sternum. This is the aortic area. And to the left of the second intercostal space, pulmonic area. Right next to the sternum, the fifth intercostal space, the tricuspid area. And then finally, the midclavicular line, and the fifth intercostal space, the mitral valve or the mitral area. So I heard S1, S2. I did not hear any extra heart sounds and I did not hear any murmurs. So that concludes the assessment of the heart, the body, and the neck vessels. So after doing all the procedure, we thank the patient for cooperating. Sir, thank you for your full cooperation, and it's good to know that you don't have any abnormalities with your lung sounds, your heart sounds. So after that, we do the aftercare to the patient if unable to help safe, or we ask the patient to do the aftercare if able. So we ensure that the patient is on a comfortable position. Okay. So after placing the patient in a comfortable position, we do the hand hygiene. After doing the hand hygiene, we document findings to the patient's record. So that is all for my video, and thank you for watching.